doctor, I'd like to ask you about the current situation for patients in Israel. How are they easily getting access to cannabis for the treatments, or it's not that easy for them?
Yes, our patients, in generally, they could apply for medical cannabis, but it's very uneasy. Very uneasy. The process is very complicated, unfortunately.
Have you got any idea about how many patients in Israel own now a license?
We license about 30,000 patients. Currently, 25,000 are receiving cannabis on the everyday basis. So this is a lot of patients, but Ministry of Health doing a lot of attempt to reduce issuing of the new licenses, unfortunately.
Which is your paper in the ICA board in Israel, in the delegation in Israel, because you're working really closely with the parliament in Israel, is that right?
I am an advisor, and I'm an advisor of Israel, of the Parliament Committee for Cannabis Regulation. I'm a member of this committee as advisor and observer, so I provide my professional expertise to our legislators in order to improve the current legal situation with the cannabis in Israel. My efforts are going to raise the level of the awareness of the hardship that Ministry of Health cause on the way of providing new licenses, of managing current licenses. So this is a tough questions our Parliament Committee is working with.
In which state is now, let's say, the legal situation in Israel? What are you trying to achieve right now in the parliament?
We are trying to achieve the situation where the doctors could not only recommend cannabis for medical use, but also to prescribe it. It will alleviate the situation. It will allow our patients to get the medicine not through the long process of approval through the Ministry of Health, but it will be shorter. But we need to educate doctors, to attract doctors in order to allow them to rise the education and the readiness to be part of the cannabis program.
And talking about medical practice, we were talking before about this different vision of treating patients, involving their relatives and involving their families. Why it's important for families or relatives to know how to treat their own relatives with cannabis?
Yes, great question. In my opinion, as soon as we provide cannabis for medical purposes, majority of the patients are too ill in order to understand fully how to use their medicine. So we need to educate not only patients, we need to educate them, but we also need to educate and to train caregivers and close relatives in order to obtain the informed consent to such kind of treatment, to reduce stigma, to explain everything through what is going within the cannabis treatment plan, what is the plan, what aims we should achieve. So we need to recruit family members and caregivers as our closer alliance in order to help to each particular patient with his own disorder, because each patient has his own disease with his own peculiarities. So we need to adjust the proper treatment for each patient in the means of rehabilitation, treatment. So we need to adjust him medical cannabis in the form it will be suitable to him, in any form, oil, draw material for inhalation, for direct smoking. Even we do not support direct smoking as a less efficient way to consume cannabis, but we need to adjust it according to his knowledge and try to improve the knowledge of the patients and his caregivers on existing ways of cannabis delivery, cannabis way of administration. Just to some patients are not aware about many options existing, such as evaporation, suppositoria, edibles, etc.
In which ways is important for some elderly patients to get treatment with cannabis? Which examples can you give us?
Yeah, so, the larger proportion of the patients who just undertreated with the cannabis, they are elderly patients. Majority of them could and should be treated with cannabis, but majority of them are not aware about it, and their relatives are so stigmatized with a lot of prejudice according toward the cannabis. So we need to change it. We need to try to change it as soon as possible, to explain them that the quality of their life, quality of life of the close relatives, elderly relatives, could be improved significantly by the usage of cannabis in different forms, in conjunction with the current medicine they receive. But we also could replace some existing medicine with the cannabis, so to reduce overburden on caregivers and the patients. In my practice, when I worked with the patients in our nursing home, we were able, together with a geriatrician, the attendant physician who was a geriatrician, we were able to reduce about 70% of the antipsychotic, antidepressive, anti-anxiety and sedative drugs, medicine from them, allowing them only use cannabis on the everyday basis, adjusted for them. So it reduced drastically the cost of treatment on this nursing home. This is why administration of nursing home supported this program, and cannabis was supplied free of charge under the license of Ministry of Health, because we needed to have their approval. They provided us this approval, so we had a great success, and all nurses reported improvement of the basic parameters of the care for the bedridden and elderly patients in this nursing home, using cannabis as a basic treatment for them.